Hi, I'm Dr. Kelvin, and in this video you're going to learn the best tips and exercises for treating epicondylitis, that well-known elbow pain, also called tennis elbow or golfer's elbow. There are two types, and I'm going to teach you a simple treatment for each type of epicondylitis. These exercises are simple, easy, and you can do them at home. But before we get to the exercises, I'm going to explain something to you that no one has explained until now. As usual, I'm going to explain what your body looks like on the inside. In this case, your elbow, what it's like on the inside. And on top of that, you're going to learn, in practice, how epicondylitis works. Then you'll be ready to understand the exercises. Your elbow looks more or less like this on the inside, so pay attention. It's made up of bones, ligaments, blood vessels, nerves, and muscles. And if we consider lateral epicondylitis, also known as tennis elbow, it affects the tendons on the outside of the elbow. And usually, the cause of this problem is repetitive movements that overload the tendons on the lateral side of your elbow. And check this out, these tendons are responsible for the movement of wrist extension. That classic motion when a tennis player swings the racket outward. But even if you're not a tennis player, you can also, through movements similar to that racket swing, end up suffering from epicondylitis too. And the most common symptoms of epicondylitis are pain, inflammation, weakness in the muscles when doing activities, often burning sensations and swelling. But there's another type of epicondylitis. Pay attention here. It's called medial epicondylitis. Now, the pain is on the inside of the elbow. We call it golfer's elbow because it's an injury to the wrist flexor muscles. It's a movement that's more common in another sport now. And for those who have epicondylitis, whether it's lateral epicondylitis, tennis elbow, or medial epicondylitis, golfer's elbow, you know just how annoying and bothersome this elbow pain can be, right? Comment below if you feel this kind of pain. This video doesn't replace a medical consultation or diagnosis, but there is a self-test you can do at home and see if you need to see a doctor or physical therapist. This test is simply bending your elbow with your palm facing down. Now place your other hand on top of the hand on the side you're testing. Then, extend your wrist against the resistance from your other hand. If you feel pain on the outside of your elbow, that's a sign of possible lateral epicondylitis or tennis elbow. Now, to check for medial epicondylitis or golfer's elbow, you should repeat the same test, but this time with your fist closed and facing up. If you feel pain, discomfort, or weakness in the inner part of your elbow, then we have a sign of epicondylitis, a possible medial epicondylitis or golfer's elbow. And now that you understand what your elbow looks like on the inside, how this whole mess works, lateral epicondylitis, medial epicondylitis, you're going to learn the best exercises and tips to treat this problem. Don't forget to leave a like and subscribe to the channel. Click on that notification bell so you can get more videos from my channel. Because when you do that, you show YouTube that this video is important. And that encourages YouTube to send videos like this to more and more people, helping others just like you. And besides that, you also support my work here on the internet. So let's get to the first exercise. Exercise number 1. For this exercise, we start with a light strengthening movement. All you need to do is this gesture here, squeezing a small ball you have at home with your palm facing down. Meanwhile, you extend your wrist, doing this movement for 4 sets of 10 repetitions. If you don't have a ball, you can use, for example, a small pillow you have at home, or a stuffed animal. I'm sure you have something at home you can squeeze. This was a variation for lateral epicondylitis, pain on the outside of the elbow. But if your pain is in the middle of the elbow, you'll do a similar movement, except this time your palm will be facing up and the movement will be wrist flexion. Exercise number 2. For this second exercise, we're going to work a different type of muscle contraction. We call it isometrics. It sounds like a difficult, complicated name, but don't worry, you'll get it in a second. It's a piece of cake for you. If your pain is on the outside of your elbow, what you need to do is keep your elbow bent, with your palm facing down. Now, make a gesture similar to the test I showed you at the beginning of the video. You're going to place your other hand on top of the hand on the side where you'll do the exercise. And now, do a wrist extension movement against the resistance from your other hand. And then you hold that contraction for 5 seconds. So, let's do it. 5, 4, 3, 2, 1. And relax. Here we have 1 repetition. Let's go to the second repetition and count again. 5, 4, 3, 2, 1. And relax once more. Third repetition. Let's go. 5, 4, 3, 2, 1. And relax. And now that you understand, you're going to do this until you reach 5 repetitions. So, you're going to do 5 sets of 5 repetitions, and count 5 seconds of contraction for each repetition. Now, if your pain is in the middle of your elbow, you're going to do it with your palm facing up. So, it will be a wrist curl. You can do the exercise just like in the previous explanation, for 5 sets of 5 repetitions and 5 seconds of contraction for each repetition. This video about treatment for epicondylitis was inspired by these comments you're seeing on the screen. Leave a comment on this video right now too, because I read all of your comments. Also, your comment with your question could become a future video, just like this one you're watching, and you could also appear here on the channel. Exercise number 3. According to some scientific studies, this exercise is one of the most important for epicondylitis. Not that the others aren't important, but this one helps stimulate collagen in the tendon that's inflamed and the tendon that's affected by tendinitis. Anything ending in itis means inflammation. Epicondylitis is sometimes an inflammation of the tendon that's at the elbow's epicondyle. So some studies show that this type of exercise helps stimulate your own body to send bursts of collagen to the tendon. And this collagen, therefore, helps to regenerate the tendon, improving pain and inflammation. But don't worry about eccentric exercise. Even though the name sounds complicated, it's actually a type of exercise that's pretty easy, and you'll understand it now. All you're going to need is a resistance band. Now, sit down on a chair and secure the lower part of the band by stepping on it with your foot. So you're going to pull the band upward with the help of your other hand, using as little force as possible with the arm that's holding the band. And finally, you'll let go of the helping hand and lower the band in a very controlled way. For this exercise, it's ideal for the band to have a bit more tension, so much that you wouldn't be able to pull this band up with just one hand, without any help from the other. So you'll do this exercise for 4 sets of 10 repetitions. The previous exercise you did with your palm facing down. You did a wrist extension. That one is for people who have pain on the outside of the elbow, tennis elbow. But if your pain is in the middle of the elbow, medial epicondylitis, golfer's elbow, you're going to hold the band with your palm facing up. And then, the exercise will be similar to the previous one. But now, you're working on the wrist flexor muscles. Exercise number 4. Now, I'm going to show you how to do a release. Myofascial, which is a technique similar to a massage, but it's not a massage. It's used to release the muscle fascia, loosening up that tense muscle a bit. The muscle fascia, for example, is a fibrous, whitish tissue that covers your muscle. And you have muscle fascia covering most of your muscles. However, if this muscle fascia is contracted, if it has trigger points of tension in it, this will result in pain. So, releasing this fascia is a very interesting technique for treating epicondylitis. First, you're going to feel the painful area with this part of your finger here, and you'll probably feel the muscle is stiff. Now, what you need to do is press that finger, making a back and forth motion without stopping for 3 to 5 minutes. At first, it's a very sharp pain, but you'll notice that this pain goes away when you get close to 3 minutes of this myofascial release technique. If your pain is on the outside of your elbow, a lateral epicondylitis, you can also use a cream or arnica, which has analgesic and anti-inflammatory properties, and slide your finger very slowly from this lateral part of the elbow down to the back of your wrist, just like you're seeing in the video. Now, if your pain is in the middle part of the elbow, meaning a medial epicondylitis, you're going to do the same movement, but starting from the middle of the elbow to the front of your wrist. And just like you're seeing on the screen, you can also slide for 3 to 5 minutes. Alright, now that you've made it this far in the video, I'm going to give you some really interesting tips for treating epicondylitis, in addition to these exercises. The first is that you make an ice sandwich on your arm. But what do you mean, an ice sandwich? All you need are some ice cubes and some plastic wrap, and you might need to ask someone to help you do this. First, you're going to wrap 1 or 2 layers of plastic wrap around your arm, right over the painful area. The more sensitive your skin is to ice, the more layers of plastic wrap you should put on before adding the ice. Then, you're going to place a few ice cubes more or less over the area where it hurts. And finally, you'll close up this sandwich by wrapping another layer of plastic wrap around it. If needed, wrap everything with a towel, because it will absorb the melting ice so your arm doesn't end up dripping water everywhere. Do this compress 3 times a day, for 15 minutes each time. Apply it for about 5 days. It might help you. While the ice has an anti-inflammatory effect, helping to reduce the signs of inflammation from epicondylitis, the plastic wrap works to compress your arm, which is also very good for inflammation. Finally, you can use an elbow brace, which is also a great alternative for epicondylitis. You can buy one, for example, at pharmacies or orthopedic supply stores. Remember that these simpler orthoses, like correctors, posture vests, braces, knee supports, and wrist supports, should not be used all day long because that can weaken the muscle. Besides that, they should only be used for a short period of time and must be combined with physical exercises. Otherwise, they won't help. But this is another very interesting tool to help reduce pain. It reduces pain by about 20% to 30%, and for someone who is in a lot of pain, that discomfort is actually quite significant and relevant in the treatment of epicondylitis. I hope these tips and exercises have helped you. These are some of the components I share with my patients in the office who have elbow pain due to medial or lateral epicondylitis. I want to remind you that this video does not replace a consultation or a diagnosis. So if you think it's necessary, seek out a specialist. Don't forget to leave your like, subscribe to the channel. There's also a little share button right here. Look for that button and share this video with as many people as possible, so you can help others just like I'm helping you, spreading this channel like a chain of good. Thank you so much for staying until the end of this video, and see you next time. Bye!